Hello, everyone, and thanks for joining today. So I'm Elizabeth Calleja. I'm the at National Heart Foundation of Australia. I'm the Senior Advisor for Physical Activity. And the main item I'm going to talk to you in the prevention section today is a national approach to support community-led action and leadership. So this includes community education. So the issue here is that we have a need for an approach to support grassroots local health and wellbeing leaders to help reduce obesity risks and help to support people across the community, also supporting community mobilisation and understanding of this issue. Now, community-led initiatives are featured across Australia and in place help to improve health and wellbeing and reducing obesity risk, as well as helping to support people with weight management. However, there is limited coordinated mechanisms nationally for sharing these lessons learnt and best practice and collaborations where health and wellbeing programs are easily identified and accessible by community to help them with their health and wellbeing. We need further mechanisms and investments in this space. And we also need to help support the community informed decision and help with local leaders and also to catalyse collective change. We also really need to think about how we support our community and bring them in for consumer-informed ways in moving forward. Place-based projects across the country are recognised as a really high priority area that we need to work on. And to help this, we need to support grassroots leadership, an important place, which is an important place of the systems puzzle. Now, across these systems, we identify as well as helping support community to engage and help those to make change, that our environment plays a big place in this communication and conversation, particularly the design of our built environments, as they have a major influence on people's health and well-being, enabling them to lead active lives and also for access to healthy and fresh foods. Now, at the National Heart Foundation Australia, we had a What Australia Wants survey, and one of the key areas that people were highlighting was access to local places. So 77% of respondents really highlighted they wanted easy proximity to food, neighbourhood safety, and access to public and open spaces to help them to achieve their health and wellbeing goals. So we need to support community action and invest in this area. We need some resources for local communities to proactively reduce obesity risk in the community. We need to help the public to better understand the many drivers of obesity in our obesity systems map and the multitude, and we can't do this all on our own. So we need multiple areas of work to be done and also to directly help reduce stigma. But we can't start from scratch. And we know that there's a multitude of organisations who is doing a lot of work across the country with community. And we need to build off this historical work in prevention, treatment and support, stigma and mental health. So community-led interventions and ability for treatment and support and social connection is highly important. And we have multiple organisations such as the Weight Issues Network. Heart Foundation is working in that space to help support people from social connection with physical activity and Heart Foundation Walking. We've got multiple other organisations such as Deakin Global Centre for Prevention and Health and Western Sydney Diabetes, and a lot of collectives and organisations across the country. So one of the most important things as I wrap up is that Australians really want to see more happening to help support them. And again, the What Australia Wants survey, up to 72% of respondents reported that community and community facilities were important parts of connection and health for them to be able to achieve their health and wellness goals and achieve a healthy lifestyle. Now, the approach should be done bottom up, and also working at different multi-systems level with not-for-profits and also government to help to improve outcomes. So thank you, and I'll pass on to the next speaker.